Okay, again, good morning, everyone. My name is Jennifer Howard. I am the director of the Turner Senior Wellness Program. Our presentation today is on Alzheimer's disease and dementia care. And our presenter today is Carolina Sierra Lopez. She is a geriatric fellow here at the University of Michigan in Michigan Medicine. And with that, Dr. Lopez, I will just turn everything over to you, and I will turn off my mic and my camera, but I will be here to back you up.
Hi, good morning, everybody. Happy to be here. We're going to talk about Alzheimer's disease and dementia care. This is a topic that is close and dear to my heart. I see many patients in clinic who suffer from Alzheimer's and kind of navigating with families, the healthcare system, and going through the process of what is dementia and what that entails. I'll just move to the next slide. I don't have any disclosures. This topic today will go over some definitions, incidents, so when the Alzheimer's is initially diagnosed, going over population patterns and some of the Medicare costs that goes into Alzheimer's disease, risk factors for developing Alzheimer's, how it usually presents and how we usually see it in clinic. Some of the different stages of someone who has Alzheimer's will typically go through, kind of knowing what are the next steps and when to move on, what are the available treatments, and some of the newer treatments are out there, and we'll kind of go briefly over those, and also briefly some caregiver tips and things to help if you yourself are taking care of a loved one who has Alzheimer's or the caregiver one, and some good resources to have in case there's any other questions or you're more interested in the topic and knowing more about it. All right, so definition, dementia, you probably heard about this word, but what does it really mean? So dementia is basically a general term for loss of memory, language, problem solving, and other thinking abilities. And the most important part is, besides having that cognitive loss, is also having it severe enough that it interferes with daily life. And what does that mean? So basically means that the person having difficulty shopping, doing groceries, maybe toileting, maybe cleaning or cooking at home, are not able to maybe even feed themselves when it's very severe. So that those two key components are important in order for a person to be diagnosed with dementia. And a term you might not be very familiar with, but it is important to know, is called mild cognitive impairment. And this is a stage between kind of normal aging and between dementia. So it's not dementia yet, but it's just this slight decrease being more than normal aging. And it's also characterized by problems with memory, language, thinking, or judgment. So dementia is more broadly used as an umbrella term and encompasses different types of dementia. Some of them are reversible, some of them are irreversible. We'll be focusing mostly on Alzheimer's disease. It's the most common one, and it's the one we see more often. The other more common one will be vascular dementia. Some people might have more than one type of dementia, especially Alzheimer's disease and vascular dementia sometimes go together in specific subgroups of individuals, like in Black individuals or Hispanic individuals, we'll see it more commonly together. Dementia of Lewy body, frontotemporal dementia, so they'll have more personality difficulties early on in the dementia, and other more rare causes of dementia, like Parkinson's disease, so people will develop more of that movement disorder at the beginning, and usually the dementia is more, you see more at the late stages of Parkinson, usually at the beginning. Some of the reversible dementias that are important to know, and that's another reason that it's important to seek medical care. If you or a loved one have concerns about memory, seeking medical care to make sure that it's not a reversible dementia, such as depression can cause reversible dementia. It used to be called pseudodementia or fake dementia. A lot of depression in elder individuals or older adults usually shows up with more fatigue, low energy, less interest. People usually don't feel depressed, but that's how usually depression shows up. Another one would be electrolyte abnormalities, medications that can cause this. But usually people get a lot better once their medications are either exchanged or discontinued. Thyroid issues is another one. All right, so again, Alzheimer's disease, the most common type of dementia. Usually we see it with more short-term memory dysfunction at the beginning, executive dysfunction, so having difficulty self-regulating emotions or behaviors, difficulty with attention or following instructions. There is no cure for Alzheimer's disease. There are treatments available, and they usually slow the progress of Alzheimer's disease. Alzheimer's disease is a progressive dementia, and usually it works better once we start treatment earlier. That's important to note. Alzheimer's disease, we usually classify it into two categories, either late onset or early onset. Late onset is after the age of 65. And that's usually the more common type, the type we'll see the most in clinic. The older the person is, the higher the risk of developing Alzheimer's dementia. If I showed you a graph depicting that, would just be higher risk. It's usually more sporadic. It just happens because of different risk factors or other issues that we are not very clear on why it happens in certain individuals and not others. Early onset is usually before the age of 65. Individuals will start developing memory issues, usually pretty early in their life, maybe their 40s and 50s. And this is more unusual, more rare, maybe 5% of the population. And even more rare than that is the familial type. So that will be around 1% of the population. So that will be 2 other individuals in the family who also had Alzheimer's disease. That person will be at higher risk of developing Alzheimer's. Doesn't mean that they will, but they're just higher risk. All right, and then this is just a picture depicting a little bit of the terms we just went over, just to give you a broader look. So on the green line, you just see some mild decline that is normal with aging. Maybe the neurons or cells in your brain just work a little bit slower. Maybe you just have a little bit slower time of getting the right word or remembering something, but you're still able to function and do the things you need to do. And then some people will have that mild cognitive impairment. So there'll be a steeper decline that is not affecting function, but just they notice that memory issues and maybe following instructions harder. And again, some of that will be reversible depending on what the cause is, if it's medication, thyroid, depression. Also, we see a lot that people who need hearing aids and don't wear them, they're at higher risk of developing dementia. And if you think about it, right, the brain is you're not using it at its full capability. So it's very important to wear hearing aids. And I tell my patients all the time, when I see them in clinic, not wearing them, wear them. Also, having your eyes checked, because that can cause more problems with people seeing things that maybe are not there. Having their eyes checked, it's very important. Some people, if they don't have the reversible kind, they'll just kind of be stable with mild cognitive impairment and just stay there. Usually the mild cognitive impairment that progresses to dementia is usually what we call kind of amnesia type of mild cognitive impairment, so that memory loss. It's usually a little bit more associated with developing more of the Alzheimer's dementia. And then even at this beginning stages, the pathophysiology and the changes your brain is going to are already kind of developing and changing. If you were to develop Alzheimer's, we already see this pretty early. Sometimes people wouldn't even notice it on the earlier stages, and then going from mild dementia to even severe dementia. And we'll kind of go over later on the presentation of what those stages look like. Usually the earliest stages, people can have mild dementia even for 7 years. It kind of depends on the individual and how early it's diagnosed. Usually once they get to severe dementia, people will be living 3 to 4 years. So the time kind of gets less in that regard. All right. So in populations in the US, we see about 5.8 million people in the United States have Alzheimer's disease and related dementia. So And we'll see more infographics on this, just to be helpful to kind of see the numbers and pictures. And about 5.6 million age will be 65 and older. So a lot more people you'll see of the late onset or above the age of 65, and about 200,000 under the age of 65. So the earlier onset dementia will be more rare. And then this graphic is kind of showing through the years what the cost of Alzheimer's disease is in the Medicare and Medicaid, so kind of growing up exponentially through the years as there's statistical probability of the number of Alzheimer's disease itself going up through the years. Alzheimer's research hasn't accrued a lot of costs through the years, pretty stagnant. And even though we've had a lot of years with Alzheimer's disease, and I will show you another slide about it, a lot of the individuals who are involved in the research, the participants will be very, oh, sorry, the lights went off in the office. Homogeneous, so a lot of them will be white individuals, and we see that individuals who are of Hispanic or Black backgrounds have a higher risk of Alzheimer's disease. By the age of 2060, the number of Alzheimer's disease cases is predicted to rise, an estimated of 14 million people. And again, African American and Hispanic population are usually affected the most. Cases among Hispanic will increase 7 times over estimated of today's date, and cases among African Americans will increase 4 times over today's estimates. Alzheimer's disease is the 6th leading cause of death in the US. So this is a graph showing the most common causes of deaths in the US, heart disease and cancer being the more predominant, but Alzheimer's in the top 10. With COVID, there has been an increase in Alzheimer's, people dying from Alzheimer's disease, and depending on when the statistics were chosen with COVID, the COVID would have been the kind of top 4 sometimes. All right, most of the cases of Alzheimer's disease, over 2/3 will be women. It affects women a lot more than men. And again, older Black and Hispanic Americans disproportionately are affected more compared to whites who have Alzheimer's disease. And like we mentioned, ethno-racial groups have been historically underrepresented, mostly Black and Hispanics, in clinical studies, underscoring the need for more diversity in dementia research. Even more research that's coming out, we're seeing that that the pathology of how the disease progresses, and let's say a Black individual compared to white, is a little bit different. Even in tissue samples of their brains, a little bit different what we're seeing. So that could definitely affect maybe treatment options in the future or preventive measures in the future. All right, so this figure from the Alzheimer's Association, basically pretty up to date this year, 2022. 1 in 3 senior citizens will die from Alzheimer's or another dementia. More than 6 million Americans are affected by Alzheimer's disease. Between 2000 and 2019, death from heart disease have decreased by 7.3. So we're doing good strides with heart disease in the US. But with Alzheimer's disease, death rates have actually increased by 145%. So not a lot of change or progressions that we've done at kind of preventing the death of an Alzheimer's disease. And like I mentioned, 2020, COVID contributed to 17% increase in Alzheimer's dementia death, and kind of more estimates of potential costs over the years that could be even to the 1 trillion in 2050. And 80% of people don't know what mild cognitive impairment is, and we're going to talk about it in this presentation, so you won't be part of that 80% of people. You'll have a little bit of understanding what mild cognitive impairment is. All right, so this is basically a breakdown of how a normal healthy brain on your left looks like, and a person who has Alzheimer's disease on your right looks like. So you can see kind of general atrophy or diminishing of the brain tissue, especially the gray matter. And then I don't know if you can see my mouse, but kind of the hippocampus of the brain. So that's kind of more of an inner brain structure that's very complex, that is associated with memory, that will also diminish very significantly in a person with Alzheimer's disease. And the way we think Alzheimer's disease, what we know right now, is comparing healthy brain to a person who has Alzheimer's disease brain. The neurons or cells that are encompassed in the brain, a person with Alzheimer's disease will develop kind of deposits of amyloid plaques, so the little brown smudges on the picture, and some tau protein inside the neuron cell. So think about this, about like a roadblock and construction work on the road. So the cells are not able to kind of work and clean and do the things they need to do and transport information because of this roadblocks and construction work. So it really kind of damages the cells and tissue, and some of those neurons die because of it. A lot of this is associated with inflammation, stress, and we see that a lot. All right, so going over some of the risk factors, like we mentioned, age. The older you get, the more likely of developing Alzheimer's or some type of dementia. Lifestyle, people who are more sedentary have a higher risk of developing Alzheimer's disease, and that's kind of associated with, as you see below, other factors: high blood pressure, high cholesterol, diabetes. It kind of goes hand in hand, right? You live a healthier lifestyle, eat right, do more physical activity, those risks get lower. Or maybe even if you have high blood pressure or diabetes, but having them well controlled can reduce those risk factors. Having lower education level is also a risk factor for Alzheimer's disease. So if you think about it, person who's had higher education or are using their brains more will keep more of that function of the brain. Family history, like we mentioned. If you've had more than 2 individuals in your immediate family with Alzheimer's disease, you're at higher risk. Doesn't mean that you will develop it, but just a little higher risk. Some genes that we know are associated with Alzheimer's disease. One of them is chromosome 21. So individuals who have Down syndrome, they have an extra gene of chromosome 21, and that's the gene associated with the deposit of amyloid, so the roadblocks here. So individuals who have Down syndrome, usually in their 40s, they'll develop Alzheimer's disease. So even though they're 4 years old, genetically they're a lot older. Environmental toxins also associated with Alzheimer's disease, head injury, like veterans or people who've had a lot of head injury are more associated with Alzheimer's disease. And like we mentioned before, hearing and vision, very important. People who don't wear their hearing aids, higher risk of developing dementia. Getting your eyes checked, making sure your cataracts are, if you need cataract surgery, getting the surgery, or just having it checked, very, very important. And some of the protective factors to trying to avoid, if possible, developing Alzheimer's disease. It's not that you won't develop it, even if you follow all the protective risk factors, but just a less risk. Basically, having a healthy lifestyle, being physically active, exercising, moving your body, also being more active mentally, doing puzzles, being more active socially with the Turner Senior Wellness Center. It's a great opportunity to be more active in the community and talk with other individuals. The Mediterranean diet is the one that has been more studied, is pretty rich in omega-3, so that's your salmon and avocado. It kind of has that antioxidant properties. So we talked about some of those roadblocks that get built or deposited in the brain cell are associated with inflammation and stress. So having that antioxidants with your diet works a lot better to prevent that. Also, some of the antioxidant properties in a red wine have been studied to kind of help, especially vascular dementia that sometimes can be associated with Alzheimer's dementia. So having a glass of red wine with dinner can also be protective, right? In moderation, not going to the 2 extremes, not drinking too much. So 1 glass is fine, but if you're drinking 2 glasses every day, that's maybe too much. The recommended amount for alcohol use for older adults is no more than 7 glasses in a week. So if you're kind of below that, or you should be okay. Having education, being bilingual, speaking more than one language is also very protective. Like I mentioned, social activities, cognitive stimulation can really help. And using the hearing aids, I'll probably mention that a couple more times through the slides because I really want to drive down the point that it's very, very important. All right, so early presentation, how do we usually see this at the beginning? And kind of things to keep in mind in case yourself, if you're worried about it, or maybe a loved one, things to keep in mind. Memory impairment, usually there's different types of memories, usually more of the short-term memory or declarative memory of like an event that happened or new information that was obtained. It's not getting processed by the brain very good. Usually older memory or remote memory is usually intact. So they might still remember their parents' names or their own name, but maybe they won't remember their grandchildren's name because it's more immediate. Executive function, so inability to complete tasks or multitask, inability to kind of self-regulate sometimes. And then very commonly too is this reduced insight. So we'll have people that will come to the clinic with their partners or husbands or wife, and the patient themselves will be saying that they don't have any issues with memory, but maybe their partner are very worried, and that's part of the disease. They won't have that insight of, hey, maybe I am having issues with memory, or I am having difficulty completing tasks, getting lost in the grocery store in a familiar place. And then because of that reduced insight, they'll try to come up with excuses of why they were having a hard time doing a certain task, and try to explain themselves. So it's very important to keep that in mind. And more later presentations that will have impairment of that remote memory. So maybe forgetting their sons or daughters' names, more of that behavioral disturbance, especially sundowning. You've probably heard of that. Usually when the sun comes down, it's darker, they get more easily confused, more disoriented, they become more anxious, more agitated. Sometimes they'll even have visual hallucinations or see things that are not there. And this can be accompanied with balance issues, walking issues. They're very high risk for falls. So making sure that your hallways are clear, that they're well illuminated, you're wearing proper shoes that are not too loose, and you don't have cables around the floor or anything that a person can trip on. Because we see this a lot of people who have Alzheimer's disease kind of going to the emergency department every couple months just for another fall. It happens a lot. Then we'll go through over some examples and presentations of what might be normal to happen and what might be more of a concern or problematic. So memory loss that disrupts daily life. So it's normal to occasionally forget names of someone you just met or an appointment, but then remembering them later. But it's not normal to forget recently learned information or something that was really important, learn at that moment. That might be more of a concern. Challenges in planning or solving problems. So it might be very normal to make occasional errors with balancing a checkbook, but maybe having trouble following a familiar recipe or taking much longer to complete familiar tasks might be more abnormal. Kind of like I mentioned, difficulty completing familiar tasks. It's very normal if you have a new appliance at home, a new TV, a new iPhone, maybe forgetting the settings or how to manage that. That can be pretty normal. But if you're driving to familiar locations, either the grocery store or church, or you're getting lost, a place that you used to not get lost in and you used to know pretty well, that might be of a concern. That might be more problematic. Confusion with time and place. It might be pretty normal to forget day of the week, but maybe remember it later. I had a patient that came in because they were concerned about memory, and they mentioned, oh, I forgot my wife's birthday. And I asked, were you usually someone who remembered their wife's birthday? They never actually remembered their wife's birthday. So it wasn't a new issue for them. So if it's something that you're usually pretty good about, and then you're having a hard time remembering, it might be a little bit different with someone who's not very good with birthdays. at baseline. So more problematic, kind of losing track of dates or forgetting where you are, how you got there. That's a lot more concerning. Not understanding something unless it is happening immediately. So not having a good grasp of context of what's happening. Trouble understanding visual images or spatial relationships. So it's normal to have some vision changes from cataracts or having dry eyes. But if you're having a difficulty kind of looking into a mirror and you're thinking someone else is in the room, that might be more problematic. New problems with words when speaking or writing is very normal to maybe have trouble finding the right word, or you feel like it's in the tip of the tongue. That happens on occasions, pretty normal. But it is a problem when you're have a trouble following or joining a conversation, have problems finding the right word, or you call a pen, you call it a watch, then that's more problematic. If it's more of a complete error. Misplacing things and losing them, or losing the ability to retrace steps. So common, people misplace their car keys or their phones, but it's not very common to put them in bizarre places like car keys inside of the fridge, or lose things and cannot retrace the steps to find them at all, like not even having a good grasp of maybe in this room it could have been, or accuse others of stealing. We see this very commonly when people misplace their objects. They'll accuse that someone is going to their house and stealing, which is not impossible for it to happen, but sometimes it might not be true. Decrease or poor judgment, normal to make maybe a bad decision once in a while, but a lot more concerning if you're having a lot of problem with dealing with money, falling for a lot of scams. Some people do fall for scams, but if it's a recurrent issue, despite knowing, things to avoid with scams, that might be more problematic. Having poor grooming can also be problematic. Being more withdrawn from work or social activities. It's normal to not feel very social on occasions or not wanting to go to work, but it might not be very normal if you're someone who's usually pretty sociable or engaged in social activities to be completely withdrawn and not want to talk with anybody and completely withdrawn from their hobbies that they used to enjoy. And changes with mood or personality. It might be normal for certain people to develop a specific way of how they want to do things and being a little bit irritated when things are not going their way or how they usually expect things to go, but being very inflexible, very anxious, very suspicious with anything that is outside of their comfort zone might be more problematic, especially if it's a new issue. If they were usually, some people might be very strict and very inflexible at baseline. That might be their personality, but someone who didn't used to have that issue and is now having that issue, that's a red flag. That's something that I would be more concerned about. All right. So in the different stages of Alzheimer's disease, so like we mentioned, mild cognitive impairment, they're usually able to function and do the things they need to do in their daily life without much issue, but they might notice some short-term memory loss, and it usually starts over the hippocampus, which is that little blue C that is in the picture. Supposed to look like a seahorse, and that's why they call it hippocampus. I don't really see it, but it's a complex structure that's associated with memory. So usually it starts in that area, and it can last 7 years, maybe. Having that mild cognitive impairment, mild Alzheimer's can last a good chunk of time. But once you're getting to more of the mild Alzheimer's, you'll have more difficulty with function and will involve more of the temporal lobes and parietal lobes. So more reading problems, poor object recognition, poor direction to sense, and more moderate Alzheimer's disease. So it affects more the frontal temporal lobe. So that's the part of the brain that's associated with self-regulation and more impulse control. So people will start having more agitation, more difficulty with impulsivity, poor judgment, short attention span. And more of the severe Alzheimer's disease will affect more the back of the brain, the occipital lobe. So they'll have more problems with visual problems. All right. And then this is a graph that basically states the functional stages of Alzheimer's disease and how we as physicians are looking for when we're seeing a person who has memory concerns or Alzheimer's disease, just seeing how well do they function. So a normal person who's able to function without any issues, that might be a stage 1 normal adult. A person who has some personal awareness with some functional decline, recalling names or objects, might still be it can happen, that might still be normal. This is stage 2. More early Alzheimer's, more noticeable deficits in demanding in occupational and social settings, like getting lost to travel to the grocery store or the church. We can see that more early in Alzheimer's. And kind of mild Alzheimer's disease requires assistance with complicated daily life tasks like finances, medications, grocery shopping. More of the moderate Alzheimer's requires assistance with proper attire and independent community functioning, kind of dressing themselves and kind of doing activities of daily living, either cooking, cleaning. They might forget to bathe regularly, and driving is pretty compromised. So that's an important thing to know, if you're getting lost in familiar places and there is some concerns or you do have Alzheimer's disease, just knowing when maybe driving is not the best for you or your loved one, just for their safety and the safety of others. If there's concerns that you're not sure, occupational therapy can actually do a driving test and see, hey, how safe it is to be driving in this case, or if it might not be safe because of refluxes and so on and so forth. And kind of more of the moderate to severe Alzheimer's will require physical assistance with dressing and bathing and toileting. We will see some urinary or fecal incontinence, so having accidents that are not because of an infection or some other medical issue. And then once we get to the very severe Alzheimer's, people will actually have a hard time speaking, so they will only say 2 words, maybe 6 words at the most. Sometimes it will be out of context, so what they're saying is not really in tune with what the conversation is about. And oh, sorry, something popped up on my computer. Okay. And then they'll also have the difficulty with functioning with daily life. They only get a lot of help with toileting, urinary incontinence, bowel incontinence, showering, cleaning, doing it most of everything. And then they'll keep progressing to not being able to walk, and keep progressing to they won't be able to smile. They'll be mostly catatonic, so not really responding to any outside stimuli. Sometimes even severe enough, they will have difficulty just holding their head up. And once we see this severe Alzheimer's disease, and we see this with either because of the Alzheimer's so severe, they can't keep their weight up because if they're having a hard time feeding, or even with caregivers, they're still losing a lot of weight. So if they have very severe weight loss, even 10% of their body weight, we estimate that maybe just because of how severe the condition is, they might have around 6 months of life, and they would qualify for hospice care. Or if we're seeing the severe Alzheimer's and they have really bad heart failure or really bad liver disease, that they're going to the hospital all the time, because of those 2 things together, they might also qualify for hospice. And hospice, you probably heard the word. A lot of people will get very scared of the H word, hospice, but it's basically an extra set of eyes, an extra set of hands. Hospice is using your Medicare Part A to cover more nurses, more care at home. If people are having a lot of difficulty caring for their loved ones at home, they can have hospice care in a facility. The insurance won't cover room and board, but they'll cover all the other expenses and medications, just keeping them having a higher quality of life, keeping them more comfortable. And some people do very well in hospice. They even perk up a little bit, and the remaining days that they have better quality time with their family, and they're, surrounded with their loved ones and more comfortable environment than being in the hospital or with getting labs drawn, having people wake you up all the time, being uncomfortable. And then just like everything in life, for hospice care that we think maybe they'll have maybe 6 months, give or take. No one can tell you exactly when someone's gonna pass away. Just like when a person is pregnant, they'll have an estimated due date. So they'll know maybe around this date, that will be your due date, but no one can tell you exactly when you'll give birth, at what time exactly. So some people will be eligible for hospice, but they'll surpass the 6 months. And if we still think they still qualify for hospice, then they'll get renewed for hospice care. Some people will be on hospice care for a year. Some people will be a little bit longer on hospice. Some people might be a little bit less. Everyone's a little bit different. But it's a good tool to have and to use, especially when we think the person might not have a lot of time, kind of helping with quality of life and depending on their goals of care and what's more comfortable for them. All right. So some of the testing that we'll do when the person has concerns for memory or you think they could have Alzheimer's disease. So very important, if you or your loved one have these concerns, going to the doctor's appointment with a family member or you will accompanying your loved one, because the doctors really need to have someone else to corroborate the story. Because like we mentioned at the beginning, people will have very poor insight. So they themselves might not know that they're having these difficulties or these issues. It's very important to accompany that person so you can help the doctors with that additional history. You'll have cognitive testing. So they won't test for intelligence. They're not testing for IQ. They're just testing for different cognitive abilities of the brain, like language, visual, memory. So they'll test for that. They might do lab testing, and that's mostly to check for the reversible causes or other things that could lead to memory impairment, like some vitamin deficiencies or thyroid or electrolyte abnormalities or some other medical conditions that could lead to that. Medication review, again, some medications like opioids can be associated with memory loss and decreased function. So it's something important to review. They might do brain imaging also to see if there's other causes for the memory loss. And usually with brain imaging that is more consistent with Alzheimer's, it would again be kind of more of that atrophy or that thinning of that specific brain structure, the hippocampus. So biomarkers, usually the specialists will order those, more the neurologist, if they deem it's necessary. So that could be getting spinal fluid. So your brain and spinal cord are all surrounded by fluid. They draw a little bit of that fluid, like when you get an epidural kind of needle in the back, draw a little bit of that fluid, get some markers, see if they think you could have Alzheimer's. PET scan, it's another type of scan. It kind of looks at the active areas in your brain, how the metabolism. So they'll see if they think you could have Alzheimer's disease. And then serum biomarkers or blood tests, it's still in research, it's still ongoing. We still don't have any that we use usually, unless you're part of a research trial. But it's something that we've been trying to develop for many years, but not quite there yet. So for diagnosis, so usually we have to look at the whole picture, because the only way to know 100% if someone has Alzheimer's disease or not is looking at brain tissue after they passed away. So using all of the things we talked about before, you'll have a 90-95% chance, pretty good chance that we can do an accurate test. And we also have to see, that it's a progressing issue, because because with Alzheimer's disease, there'll be a continued progressive decline. For example, for vascular dementia, someone had a stroke and maybe they had a decline and they stabilized. So it'll be a little bit different of what we're looking for when a person has Alzheimer's disease. And again, kind of impairing that function and cognitive impairment, like having issues with new information, reasoning, handling complex tasks, language, personality, and behavior. And we'll go briefly over the available treatments. And the thing I want you guys to remember the most is, if this is another reason why seeking medical care earlier rather than later is very important. People do a lot better when they start treatment earlier. The treatments they don't cure Alzheimer's disease, but that slope that we talked about, it just basically kind of slows the progression. So it's not so it doesn't progress down so quickly. So it just kind of slows the progression. Most of the medications are available are more for symptomatic management. So slowing the progression of memory, or once they get to that moderate to severe, kind of slowing down a little bit of the agitation or behavioral issues. We're also going to talk about very briefly about aducanumab. Oh, yeah, go ahead.
Oh, hi. So sorry to interrupt. Your slide is still on stages of dementia. I'm not sure if you had a slide.
That's weird.
For it may not have caught up with you.
Okay, maybe there's a lag. Do you see the functional one, or do you still see stages?
I still see stages of dementia.
Okay, let me stop sharing and then I'll try to share again. I'm sorry about that. I'm not sure what happened. How about now? Do you see testing?
Okay, yep, now we see testing.
Okay.
Perfect.
I'm so sorry about that.
No worries.
Let's see. All right, so we were talking mostly about treatments. And then, yeah, we'll talk about aducanumab. This is the more newer treatment option. It's the only one that's disease modifying, and what that means is it's not really to help symptoms, but there has been some, we'll go about it later, but it shows a little bit of change in the amyloid deposits or those roadblocks. And again, it's very important to start treatment earlier, just because it will slow a little bit more of that progression, and it can provide the patient and the caregiver slightly more comfort, a little bit more dignity and independence. That's pretty important. All right, so the more common one will be your cholinesterase inhibitors. We usually start this at the earlier stages, so the mild, moderate Alzheimer's disease. So they basically work by increasing this neurotransmitters or acetylcholine, so it kind of increases a little bit of the brain activity. There are 3 different medications: inositol, which is Aricept, rivastigmine, and galantamine. They come in tablets, capsules, and there's also patches. They're usually pretty well tolerated. The most common side effect will be kind of diarrhea, nausea, vomiting. When people are started on the medication, they need periodic assessments to check, hey, is it helping, or are they having a lot of the side effects that are very intolerable? This will work about 50-50. So half of the people will have some benefits, some other might not feel any benefits. So that will be a reason to stop the medication. Some people, because again, it kind of increases the brain activity, will have more vivid dreams at night. So the way to help with that is just taking it in the morning time, so they don't have those vivid dreams. All right, and then the other treatment is memantine or Namenda. We use this more for moderate to severe Alzheimer's disease, and it basically just helps protect the brain cells. It can help with behavioral disturbances, agitation, and we usually just add it on to the previous medication. So you started with, let's say, Aricept or donepezil, and then they did pretty good, but now they're progressing to the moderate Alzheimer's disease. So this is another medication that we can add on. And then the last medication that we have right now is the aducanumab. If you use social media, or you probably maybe read it in the newspaper, it had a lot of social media following. because they cannot brand it as this new Alzheimer's disease medication that's gonna cure everything. But it's pretty controversial. They did a study, but they had to cut it short because they felt it was helping. And then they did another study with the same medication, but the results weren't the same as the previous study. It was also kind of expedited FDA approval for this one. So basically on the, hoping you guys can see the picture. This is a kind of brain images from a PET scan. So the red areas is where you see the amyloid, so the roadblocks deposit in the tissue. And with the higher dose of the medication, which is an infusion that you get once a month, you would see that the deposits or the roadblocks got taken away or were destroyed. But it's not very clear, okay, so we see that it decreases the amyloid, but did it really help the person? Is it really helping the progression of the disease? It's not very clear. Currently, Michigan Medicine or University of Michigan does not carry this medication. And right now it's only available in research trials. So it's usually not really available in the clinic setting yet. There's also word on the street that there might be another medication coming in September that is an IV-based medication, but we haven't heard much from it either. And kind of very briefly, just going over some caregiver tips. If you or a loved one care for someone who has Alzheimer's disease, it's just it's very helpful to have visual and verbal reminders or orientation. And you'll see this in the hospital. People have the little whiteboards, and the nurse will try to put in today's date and the time. We'll have a clock that's visible to the patient's room to try to help orientation. So they just might need more visual or verbal cues of, where you are and what time it is and what's happening, kind of the context. Having a scheduled routine might be helpful, kind of decreases the anxiety that can come with being very disoriented of what's happening. Breaking tasks into small steps. So again, they'll have a hard time kind of following multitasking or following like a recipe. So just breaking things into small steps is more actionable and doable for them. And then with answering questions or talking, just having short, simple answers will be the most helpful. Let go of little things. Sometimes they have a hard time self-regulating, or they might say things that might come off as mean or rude, but just letting go of little things because they have a hard time regulating that. And then sometimes distraction can be very helpful to avoid them getting more angry or escalating. Distraction works very well. And if you're a caregiver, very important to have a break for yourself. We want to avoid caregiver burnout. Sometimes it happens that a family member will be unable to care for their loved one that has Alzheimer's disease, and they'll get to a point that they just drop them off to the emergency department because they can't take care of them anymore. And we really want to avoid that. So making sure you're taking breaks. It's definitely okay to ask for help from your community, other family members, talking with the clinic or social workers that can help you have extra set of hands, a nurses, someone else to help. Check in with yourself, spend a little bit of time on your hobbies and things that you find meaningful. And then also practice gratitude and forgiveness for yourself as well as you're taking on this task of helping someone else, being flexible with yourself too. It's very important. And then if you want to know more about Alzheimer's and are interested in the topic, the Alzheimer's Association is a great website. They provide a lot of patient information and information on Alzheimer's in general. They also have up-to-date research on what's going on. And then there's also a booklet, 36-Hour Day by Nancy Mays and Peter Robbins. It's basically a very extensive guide for a person who's caring for someone with Alzheimer's disease. And it kind of goes through all the medical terms, all the stages, expectations, and it's pretty helpful. And then some take-home points. I know we went through a lot of information, but if you can remember anything from this talk today is the most important thing is living well. be physically active, be socially active, be mentally active. The picture is from Henrietta. She started running marathons in her 70s. She was 76, and she broke a world record of being the oldest individual of completing a marathon. And then she ran the next year and she broke her own record. So it's never too late to take a new hobby or do something that you enjoy. Seek medical care earlier rather than later for yourself or a loved one who's suffering from memory. The sooner we make sure if it's a reversible or irreversible cause of dementia, or the sooner you get treatment, the better outcomes are. Wear your hearing aids if you use hearing aids, and get your eye checked too. That's very, very important. And always think of next steps. Like we kind of briefly went over in the presentation, kind of thinking, if you're having the problems of memory or there's concern for Alzheimer's, when might be a good time to stop driving for your safety and the safety of others? When might be a good time to think about having a power of attorney, or having someone that you trust that will be taking care of you in your best interest when you're unable to make medical decisions on your own. That can be a son or a daughter or your spouse, but having someone assigned, having advance directives, so having in writing what you would want to have done medically if you're unable to make decisions. Do you want to be intubated? Do you want a feeding tube? Do you want all this care? Do you rather have more a natural process? Because this having advanced directives is really a blessing for the family. A lot of the family will feel very guilty of withdrawing care or not being as extreme with care, because they'll feel that they're letting their loved one down, but maybe that's not what you really wanted. And it's a real blessing for the family to have this advanced directive, so they know, hey, this is what mom wanted, and we're gonna follow her desires. And then also thinking, when might be a good time for hospice care, and having that extra set of hands and extra set of eyes on your loved one, and kind of thinking more of a quality of life and comfort focused care. All right, this is my references, and now time for questions. So if anyone has any questions, feel free to write those in the chat or let Jessica know.
So as a reminder, everyone, if you have questions, you can type those in the Q&A box at the bottom of your screen. And so I know you had shared the slides with me. Is it okay if I share the slides with participants today?
Yeah.
So I've asked that question.
Yeah, no problem.
Okay, fantastic. I'll send those out to anyone who registered for the program. So I have a question to get started. If someone is worried about a loved one and they're seeing cognitive changes, how do they approach a conversation with that person? And then if they do, and that person is in denial, complete denial, but they know something is really wrong, any recommendations on how to have that really tough conversation?
Yeah, that's an excellent question. And there might not be an excellent answer, because everyone's going to be a little bit different, and relation dynamics or family dynamics might be a little bit different. And like we mentioned, people who would suffer from Alzheimer's disease, they won't have a very good insight. So it's very hard to convince them. Then they do, but maybe just convincing them, hey, let's just have the doctor kind of check you out, just make sure everything's okay, because I'm worried, and this is coming from a place of love and understanding and caring, might be a good way to approach the subject. But again, there probably is not a perfect answer for that.
Okay, great. Thank you. Another question, you had mentioned driving before. I know this is a question that we get a lot. Can you tell us, when do you know when it's not safe for someone to continue driving?
Yeah, that's another excellent question. And I know driving is very difficult, because you are in a way losing part of an independence and having maybe to rely on others for driving or getting to the grocery. So it's very difficult. Us as physicians, right? We're not the police. We don't take people's driving licenses away, but maybe we do make recommendations like, hey, might be a good time to think about, it might not be the safest for driving. So usually when you're having the issues with memory, that you're getting lost in familiar places, or you're having a hard time multitasking, because when you're driving, you have to multitask, changing lanes, you have to go take this exit. So having those difficulties, bring it up with your doctor. And again, they can have a more formal check to see if driving is safe still or might not be. With occupational therapy, they can do like a whole driving assessment, and that can be a good tool to kind of give you more formally, hey, this is the actual data that we have about your driving.
Okay, all right, thank you so much. Another question that we get quite often is, how do you know if when someone may not be safe to live alone? What if someone is having cognitive changes, but they're living on their own? You know, when do you know, when do you know it's time to make a change, if, or what kind of resources, you know, are out there to help people in that situation?
Yeah, so definitely if they're having a hard time just keeping the house clean, keeping the self clean, not being able to do a lot of the tasks that are needed, like cooking, showering, it might mean that they might need either someone to go into the house a couple times in the week to check in on them and help them with those tasks, or maybe having them live with you. There can be a nurse aide that they can be expensive sometimes. Just someone to help a couple times a week. They can do some cleaning and just administering medications. And right, some people will need to move into an assisted living. So that will be an extra set of eyes and hands on your loved ones. So usually the clinic social workers are really good about checking with insurance and checking which facility might be better for people. I think there's a government website, and Jennifer, you probably know more about this. It's like looking a place for mom. It's like a Medicare website, and it kind of goes over assisted living and areas and facilities that are available in the area. I have to check the website, but I think it was something like that, looking for a place for mom.
Yeah, I appreciate that. I will say for everyone on the call that if you have questions about safety, housing, caring for a loved one with cognitive changes, feel free to call us here at the Turner Senior Wellness Program. We do care consultation at no cost and can sit and talk through these options with you. The Housing Bureau for Seniors also can talk through housing options. I know it's important to know what Medicare and Medicaid will pay for and doesn't pay for. A lot of folks think that Medicare pays for long-term care, and that's not the case. So, but we can talk about what is covered. I also did put the Alzheimer's Association website and their 24/7 helpline number in the chat. And so those are also other really great resources for people. One more question that I had, you had mentioned medications that can help maybe keep somebody functioning better for longer, you know, treatments. There's no cure, but there are some treatments. I'm wondering, are other medications ever used with people with Alzheimer's disease if they're having some difficult symptoms, you know, like depression or paranoia or agitation or things like that? Are there other things that the doctor can do to work with that person to help ease some of the symptoms of the disease?
Yeah, definitely. So the ones we went over are more Alzheimer's specific, but yes, if someone's having anxiety, depression, loss of appetite, there's antidepressant medication and antipsychotics that can help with agitation as well. So it kind of depends on the person, which one might be the best for them. But there's definitely other medications in conjunction or together with the Alzheimer's medications that can help with behavioral and depression that we use very typically.
Okay. All right. Fantastic. I appreciate that. So we do not have any further questions at this time. Was there anything else that you wanted to share with our folks before we wrap up today?
No, just remember, any questions, you always check in with your doctor or check in with Jennifer. They have a really great resources in the Turner Senior Wellness Center. They have really good activities for social interaction, talking with other age-related individuals, or being more physically active in your community is very important.
Thank you so much. I will point out also that here at the Turner Senior Resource Center, we do have the Silver Club, which is a program for people in the early stages of memory loss. And then there is an adult day program for people in the moderate stages of memory loss. So those resources are available as well. Okay, well, with that, Dr. Lopez, thank you so much for this today. Really great information. And we will get this recording on our YouTube playlist shortly. And for anyone who registered, we will get the slides delivered to you as well, so you can have those to look through. Give us a call at 734-998-9353 if you have any further questions or need resources. And with that, just thank you again for a really wonderful presentation.
Thank you. Bye.
Bye, everyone.